Hi, good evening, Cassie. Hi, my name is He, and I'm a nurse practitioner student. So today I'm going to do a physical assessment about your chest, your lungs, your heart, and your vessels. Is that okay?
Yeah, sure.
Okay, so let me ask you some questions. Do you have any cough?
No,
Any short breath?
no.
All right. So I'll start with check your trachea. Okay. So your trachea is in the middle line. So it's symmetrical. This is suprasternal notch. This is the sternum. So this is the Lewis angle. Good. Let me take a look at the shape. So it's bilateral symmetry. I don't see any rib prominence. And also the posterior, this posterior and anterior diameter to the lateral diameter, it's about 1 to 2. All right. So the respiration rate is about 16 and uh, looks like no effort on a respiration. It's an easy breath and it's also symmetrical. I don't see any accessory muscle used. Good. So the chest movement. Take a deep breath for me. Good. The chest movement is symmetrical, bilaterally, regular, and periodic. All right. Could you take deep breath for me again? All right. So I don't hear any like audible sounds like crackles, wheezes, bronchi stridle, or friction rubs. Okay, next I'm going to do a thoracic expansion for you. Could you just turn around? All right. Okay, take a deep breath. Good. So the thoracic expansion is like a symmetrical, and the distance is about 3 centimeters. All right. Good. So you can next will palpate for the correctus sound, just to see that any correctus sound. No, there's no correctus sound. So next I'm going to check your tactile correctus. You just say 99.
99,
Say it again.
99,
Say it again.
99.
All right. So the tactile parameters, I can hear the both sounds. It's symmetrical. There's no increase or decrease the sounds. So the next I'm going to listen your lungs. Take a deep breath. Good. All right. So could you like raise this arm for me? Good. Take a deep breath. Good. All right. Just turn around. Take a deep breath for me. Good. Good. Could you turn around? Let's check your deep breath. So, all right, I can hear that's the normal lung sound. It's I can hear some vascular and bronchial sound. I don't hear any abnormal lung sounds. It's like crackles, rares, wheezes, bronchi, stridal, friction rhymes. Okay.
Right.
Uh, now, the next one, I'm going to measure your diaphragmatic excursion. So what I want you to do, firstly, you take a deep breath, then exhale all the air, hold your breath. Is that okay?
Yeah.
Okay, so you can just turn around, go to the other side. Okay. So take a deep breath, then exhale, then hold it. Okay? Okay. Okay. So should be here. Then I want you to take a deep breath and hold it. Hold your breath. Don't exhale. Okay? Do it again. All right. So it is 3 centimeters. Next, I'm going to check the vocal resonance. So just say 99.
99, 99, 99, 99, 99, 99.
All right. So the vocal resonance, it's muffled, indistinct. It can be heard stronger in the media of your lungs. All right. Next, I'm going to check your heart. So at the beginning, to inspect some anatomical landmarks. So this is a suprasternal notch. This is sternum, and the apex should be in the uh, fifth intercostal space and the middle clavicle line. All right, good. So this is the location of apex, and okay, good. I can see the apical pulsation. I don't see any halves or lifts. Good. The next I'm going to palpate. This is the apex first, and the left sternal border, and the base. Okay. Next, I'm going to check the sphere to see any spheres. All right. So there's no spheres I can feel, but I do feel the epic pulsation. All right. So next, I'm going to like osculate your heart sound. The first one is this is aortic sound. Uh, uh, yeah, this is the aortic sound. I can hear loop loop. This is a pulmonic sound. This is the Urbus area. This is the tricuspid area. The last one is mitral area. Okay, I do hear the normal has some S1 and S2. It's like loop loop, and S2 sound. I can hear the splitting S2 sound from your palmic area. So next, I'm going to use the bell of the stethoscope to listen for your for the murmurs. So aortic, palmic, herbs, tricuspid, and the mitral. I don't hear any murmurs from all of the areas. All right. All right. So next I'm going to check your vessels. Firstly, let me check your carotid artery. Okay. You can feel the carotid artery pulse. Let me check this side. Good. So right now I can see the jugular vein distension. So I'm going to raise your hand. No. Okay. So now it's about, let's put a bit more. Okay. Just go back a little bit. Okay, it's about like 45 degrees. And this is the highest distension side. And this is the suprasternal notch. So I'm going to measure. So it's about 3 centimeters. Okay, now I'm going to check your upper extremities. Look at the skin to feel it is warm. And the artery, the bronchial artery, the radial artery, the capillary refill time, about 1 second. Okay. The other side. All right. The same thing. Check the skin. Is it warm? And also try to compress a little bit to see any edema, pitting edema. So the refill time. So 1 second. Now I'm going to check your popliteal artery. So now you can go like this. Could go a little bit higher. Next will be the dorsalis pedis pulse. So another thing is to check the hormone sign. So hold the foot and compress forward. And also squeeze the calf to ask the patient, do you have any pain from there?
No.
No? Good. Okay. So the same way to check the other legs. All right, so the hormone sign is negative.